fish women, men fish.
Female.
Yeah. Female, not women. Female on the male. And it's like, and some they were finding ovaries, and they were finding, and then there was a certain kind of fish that they stopped reprocreating, so there was no more of those. And they were like alarmed by this, and they realized it's a lot to do with them, the hormones that were going into the water from the pill.
I read that in my husband's fishing magazine.
Really? Oh, yeah.
Gotta be true then.
It's really easy to learn. It's not difficult, and like especially with CCL, they have put it on that you can go online to learn it. You can take a home study, or you can take a class. And the classes now, they've changed them. Like they have brought it up to 3 classes in the 1-month period. And the thing about it is, like the first class you learn, you can start using day 1 the next day. It just empowers a couple, and it's really amazing because, and also trying to empower the professionals, the doctors, because, and I had the same experience. I was told, oh, well, you know that's a rhythm count. I'm like, doc, I mean, this is the 2000s. This is not the rhythm, you know? And he's looking at me like, what? And it's like, you know, it's just simple. And if I can do it, I mean, anybody, you know. And what we get also as well is the Hispanic. Because my husband and I, we were Hispanic, so we go and try to, and you get this idea that Hispanics are less, less unable to understand. And when we tell them, their eyes are like, this is simple. And then when we tell the priests or we tell the professionals in the Hispanic, they're amazed that you people can do this, you know. And I said, well, that's, we are, you know, God's given us this great, and to use it, so. So, is it NFP versus contraception? Isn't NFP the same as contraception? If a married couple is using to postpone or avoid a pregnancy that they're not ready for? Well, no, it's not. It does not, there's a big difference. Like, one thing is just saying that contraception it's different, as bulimia is different from fasting.
Okay, I just saw the 5-minute sign, so we've got to contraception, the use of mechanical, chemical, medical procedures to prevent the conception from taking place. It is a violation of the human body, which is also a violation of the individual person and a violation of love. Quickly, we'll just go through several types of birth control and talk about the side effects. The barrier methods, withdrawal, condoms, diaphragms, spermicides, vaginal sponges have multiple side effects ranging from allergies related to those to bladder infections to even toxic shock syndrome, which is from the sponge. And these are direct physical actions to prevent the completion of the marital act. The IUD, I mean, when we first started teaching natural family planning, it seemed like it was kind of gone, but now they've come back with new kinds of IUD. My husband is a chiropractor, and he has x-rays done on his patients. He can see so many people have IUD, they show up on their x-rays. But now they're in 2 categories. There's the plain IUD, which is inserted into the uterus. It does nothing to prevent ovulation, but it does prevent implantation of the newly conceived life, and is strictly an abortifacient. The second kind of IUD is the hormone-embedded IUD, and it emits progestin, which can sometimes inhibit ovulation. If for some reason that fails, then it acts as an abortifacient and will terminate the new baby's life. Side effects from the IUD, there's a lot. They can cause ectopic pregnancies, increased menstrual bleeding, and uterine perforation. And it's also the leading cause of infertility due to infections in the uterus and fallopian tubes. Sterilization, the tubal ligation or vasectomy, you're treating your body as an object. When you do that type of thing, you're removing a healthy, major, functioning part of your body, and that's an attack on your entire human person. It's working, it's fine. People say to us, we hear all the time, you know, aren't you going to get fixed? You know, but our bodies work fine. We're already fixed. we're fine. But when you, people have these, tubal ligation or vasectomy, that's not fixing. That's not fixing. Hormonal birth control, the injectable and non-injectable birth control, would be like the pill, Depo, Norplant. Those are both contraceptive and abortifacient. They act in several ways. The estrogen and progestins in these type of birth control actually fool the pituitary gland into believing that there's sufficient stimulation of the ovaries, so then they will produce less of the follicle-stimulating hormone and luteinizing hormone, and that leads to suppression of ovulation in most cycles. The hormones from the birth control could also cause the mucus of the woman's body to thicken, which makes it more difficult for the sperm to travel in the woman's body. And they also thin the endometrium by depleting it of glycogen. And this decreases the thickness of the endometrium, reducing its blood supply, and that prevents the new life from implantation, thus causing an early abortion. We have so many people, when they take our class, say they never knew this. They never knew that the pill could cause abortions. It breaks your heart. It does. Here's some of the side effects. Most of these are related to the hormonal birth control. Bacterial infections, the pill weakens the immune system. Menstrual difficulties, infertility due to having been on birth control. When they go to actually have a baby, they can't conceive. Breast and cervical cancer, stroke, blood clots, birth defects in children that were conceived while the woman was on the pill, tender breasts, mood swings and depression, weight gain, ectopic pregnancy, heart disease. There's so many. I mean, we had to limit it. We didn't want to keep going on these slides, but there's a lot. We could have done a lot of slides on that. But basically, to sum it all up, natural family planning is a highly effective and healthy way to plan a family. It has no side effects, is environmentally sound, can improve your marital relationship through increased communication. Okay.
Anybody have a question?
It's not a question, it's a statement. My husband and I used that after Peggy was born from 1993 until he passed away. And I can assure you, it is more effective and better than any medical thing out there. Natural family planning is the best. I also learned one thing else too. I didn't know the low temperature associated with thyroid problems.
Anyone else?
Can I make a statement as a person who used it too? I had 5 years between my first and my second child. Then I had 3 years between my second and third child. And then I was home and said, you know what, I don't need to use natural family planning. And I was 5 months postpartum when I had after my third and fourth child. So it just showed me how effective it was at that time. But the other thing was, I think the women, we're dealing with men in a culture where they want everything to be easy. And this is where a woman has to show her strength. She has to be the one to say, you know what, this is what it could do to me. Are you willing to take this kind of risk for yourself? And what it can do to children that we don't realize that would be aborted by it. And I think it helps the man to take responsibility as a husband and a father. Because when you're first married, the man does not want to take that responsibility. He wants to stay with the buddies and still go out drinking and really not take that on. And this actually helps form that man so that he is taking the responsibility on procreative things that happen. So I think it's so highly effective, but it's also psychologically very effective for marriage.
And let me just say real quick, the way you said that about the husband being involved, the way we teach is the couple-to-couple league. I teach as a couple, my husband and I teach other couples, and they come, and a lot of times you can tell those men, the first class, they're very like, they want to necessarily not, we get into it right at the beginning, so they hear stuff that they probably never heard before, a lot of them. But by the end, they're like mapping it out on the charts. They have got it, and it's so impressive, and it does a lot for that husband and husband-wife relationship, to know, for the wife to know that he's with her on that. And it really, it does, that's in the way it starts, right from the beginning, helping those marriages. Sorry.
I took natural family planning classes twice because my husband didn't want to get involved. So he said, yeah, we'll do it if you go learn about it. So I went and learned about it the first time and conceived our third child. So I said, so, they got a refresher course coming. You want to go? Yeah, I'm coming. We did it not through couple-to-couple league. I think there's a huge difference in doing that than just offering the classes to, people because, I think them, learning together makes a big difference. And I think it helps too when you teach that way. You get over that nervousness of talking to each other about it.
Yes.
Right.
And it's also in the Hispanic population. I mean, we did one class and all women showed up, and we're like, my husband's like, no, we can't do this. Way out of, I mean, I don't know, we have to bring in some beer or anything, but we have some soccer going on. It's just that's what he said. But sure enough, the next time a little bit more came, and they had to realize, and that's my husband, just being there and saying, guys, this is, this is not taboo. This is your wife. I mean, you can't get any more precious, in that. And so they start seeing, wow, and then they start respecting it. But like it is, just teaching couple to couple really does.
Is any effort being made to get, say, the church on board? Because I find that the biggest obstacle in talking to fellow Catholic women about NFP, it will be, well, I talked to a priest in confession and he said birth control is okay. And I can't, or sterilization, and I can't tell you how disappointed I've been that way. And like, is there any effort being made to, say, for example, get with the bishop and have him mandate that NFP lessons be part of the marital preparation as they are in other dioceses? If you go to the Diocese of Arlington, I've been to Mass down there in different churches, and their bishop requires that, I guess CCL even has an office with their diocese. And you'll see like standard families of 8, 10, and they're being you hear the preaching from the pulpit, and so what's being done here? Anything?
Right now there is actually.
Bulletin though, this has been in our bulletins, and telling people that they should, phone these numbers and find out more about it.
Okay. The Office of Family Life for the diocese is in transition. We have a new person in there, Michael Stankiewicz, who is doing a wonderful job right now of trying to get this implemented. We've met with him several times. There are several other teaching couples also in Delaware that teach for couple-to-couple league. His goal is to have every couple take it, as marriage prep, but he knows that you can't go from nothing to that. So we're taking little steps to get there, getting it approved. I mean, you wouldn't even imagine, like, there's paperwork, so much paperwork and things that have to be done also, just the bureaucracy, I guess, of starting something. Because before there was nothing with the other person that was in there before. Now, we are making progress. We have teaching couples that are ready to go and teach, and we're just waiting really for the go-ahead from him.
But even CCL offers seminaries, conference for like health ones and for clergy, and that's the thing, is letting them know. Like Father Kleins is a very good promoter, and he says it. I get in the confessional and he just calls me. He says, "I'm sending you another couple because this is there, And so I mean, it's really great finally, Oh, Father Kleins sent us this and that because it is. And then, and again, going back with the Hispanic. You see it, we have dealt with priests who say, well, these poor people, we keep them, let them just, I said, no, Father, they can do it. They're intelligent. They just speak a different language, there's not, and then when they start learning themselves, they're like, wow, so yeah, it's there. But